Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us. We're happy to be joined this afternoon as well by the Mayor of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. A particular greeting this afternoon to the media who are joining us. We're glad you could make it. And if you could just use the question form here on Microsoft Teams to share your questions. And we would ask that you share your name as well as your media outlet and who your question is directed to. And a good afternoon to those of you who are tuning in on Rogers Television today, as well as on the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are watching on the CTV London website. Let's begin with our opening remarks, and we'll start today, as always, with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. As everyone likely knows by now, the Premier's new emergency COVID-19 stay-at-home order went into effect at midnight. And I want to start, hopefully, by clearing up some confusion surrounding what this order means for the average Londoner. In short, police cannot and will not be stopping cars at random to enforce the stay-at-home order. Individuals aren't compelled to explain why they're outside, and workers don't have to have proof from their employers that they're traveling to and from work. We're by no means living in a police state, however, let me be clear. We are living under a state of emergency, and for good reason. The letter of the law is one thing. The spirit of the law is another. And in this case, the spirit or the overriding message from the Premier is crystal clear. Unless it's for something absolutely essential, stay home. That's it. It's very straightforward when you look at it in those terms. The primary concern should not be, if I do this, will I get a ticket? It should be, is this activity worth the risk that I or someone else might get infected with COVID? Now, there is progress being made every day with both the delivery and distribution of vaccines, and that will only continue to improve over the coming weeks and months. In the meantime, though, we're not in a good place right now. Hospital capacity and healthcare resources are being stretched desperately thin, and in some parts of Ontario, they're already overwhelmed. As I've said before, that's what this is really all about. It's about capacity and whether our healthcare system can continue to function for everyone who needs it. We know simply that it cannot, at least not in the way we need it to, and especially not when more and more beds are being taken up by COVID patients. What happens if there are no more ICU beds or emergency care beds, or you or a loved one suffers a heart attack, a stroke, a fall, car accident? That's what we could be looking at here in London if we don't get this under control. And it's why it's so important that everybody observes the Premier's order. If it's not essential, please stay home. Over to you, Dr. Mackie.
Thanks very much, Mr. Mayor. So I'll jump straight to our numbers. Locally, we've had 92 new cases today, provincially just under 3,500. Both of those represent relatively low case counts from what we've had recently. We've seen sort of a flattening off over the last 4 days. The local numbers are tracking at or near the provincial numbers. We're slightly below in terms of the cases per capita, but we're tracking fairly closely now. The death rate, just 2 deaths today, provincially, we did see a significant number. I believe the number total was in the 60s today. Both of the provincial death count continues to trend upward, so we're not seeing a leveling off there. There is some reason for hope in these case counts today, but of course, even with 3 or 4 days of flattening off cases, we really can't make firm conclusions. This is the sort of thing we would expect if the lockdown measures that went into place December 26th are having an effect. We'd see that impact around about now, but again, we can't conclude based on the information we have yet. The other information that I want to talk a bit about today is the vaccine campaign. We continue to see large numbers of people being vaccinated at the Agriplex Clinic and also vaccination out in long-term care homes in this region and surrounding areas. Over the next few days, the Middlesex-London Health Unit, yesterday we were on site at one of the Chartwell homes, Chelsea Park, vaccinated 250 residents of the home there and some of the staff as well. Over the next few days, we will be at Strathmere Lodge in Middlesex County. We also will be at Earls Court Village here in London, and some additional homes to be confirmed on Monday, likely here in London as well. That campaign will really help get the vaccines as close to those that are most vulnerable as possible by vaccinating those in long-term care facilities who are at greatest risk of death. Roughly 60% of the deaths in this pandemic in Ontario have been in residents of long-term care facilities, and certainly the vast majority of deaths here in the London and Middlesex area as well. Dan, I will pause there. Happy to take any questions.
Thank you, Dr. Mackie. Thank you, Mayor Holder. We do have a lot of questions in the queue already, and quite predictably, a lot of them are about vaccinations. So I know that they're all a little different, and there's some subtleties there. So we'll try to get through all of those as we go along. Our first question this afternoon, Dr. Mackie, is for you. It comes from Steve Young at News Talk 1290, CJVK, and CTV London. Dr. Mackie, LHSC announced this morning that it stopped its vaccination of healthcare staff for now until all long-term care homes can get the vaccine. Some frontline staff are arguing they should get it first. The question, Dr. Mackie, is who do you think should get it first?
Really appreciate the discussion. This is a situation where there are very few doses of vaccine compared to the tens of thousands or hundreds of thousands that want it in our region. No doubt that every one of those healthcare workers and beyond deserve to get the vaccine as soon as possible. The strategy, which has really been enunciated at the provincial level through General Hillier, who's directing the provincial vaccine campaign, is that the vaccines need to be prioritized for people in long-term care homes right now. The residents in long-term care homes are the ones that are at greatest risk of dying. And so getting the vaccine as close to them as possible will help more than anything else in terms of reducing our mortality across the province. Absolutely, understand and appreciate every single healthcare worker's desire to get that vaccine. This is the provincial direction. We support it, as I know LHSC does as well, because it is the most likely to result in lower mortality.
And Dr. Mackie, a follow-up from Steve Young, and it speaks to some of what you just brought up. Is enough vaccine making it to our region? Are you having to ration who gets it?
Well, I think from the beginning, this vaccine campaign is a campaign of rationing. And really, beyond rationing, it's about trying to identify where the vaccine is going to have the greatest impact. As we've discussed before on this briefing, the primary goals in a pandemic are, number one, to reduce the number of deaths, number two, to reduce serious illness and hospitalizations, and number three, to reduce the overall impact on society, including the economy. And of course, reducing the number of deaths is by far the most important objective there. Because we know 60% of the deaths have been in long-term care, that's in a population that represents, less than 10% of the population of Ontario. So wildly overrepresented in the death stats. We know that is the best place to maximize the impact of the vaccine at this point.
Thank you, Dr. Mackie. Let's move to our next question. It comes to us from Andrew Graham at Global News Radio, AM 980 CFPL. And it's for you again, Dr. Mackie. Given the latest data, are there any hopeful trends you've observed for London or Middlesex County?
Yeah, there are a few reasons to be hopeful. The gradual leveling off of the case count over the last few days, again, we don't know if that will continue over the next few days, but at least it's not, the dramatic increases that we've seen in many days over the past few weeks. The provincial leveling off of case counts over the last few days, again, not a solid trend to, take to the bank at this point, but a hopeful trend. We've also seen the percent positivity start to level off, maybe come down in this region. So that's the percentage of tests that come back positive. The other factor that is hopeful actually comes from the sewage water testing that the city and the University of Windsor and Western are doing together. And that data shows that the number of viral copies in the sewage water in London has declined as well. So all of those things together paint a hopeful picture. Even if cases do level off now, we will continue to see the death count increase. We know the peak of deaths tends to be several weeks later, usually 2 to 3 weeks after the peak in cases. So we're still definitely not out of the woods yet.
A lot of information to digest there. Let's move on to a question for Mayor Holder. And again, Mayor Holder, this is from Andrew Graham at Global News Radio. LHSC tells Global News that retired nurses are stepping up to the plate to help with local vaccinations. Mayor Holder, are you aware of this? And if so, do you have any words for retirees who are offering aid during the pandemic?
Well, hey, Andrew, thanks for that. Yes, I am aware. And I need to give a shout out to those retired practitioners who have provided their services on behalf of Londoners. I think it's great. I think it speaks to the generosity of spirit that I have seen in London throughout this pandemic. I've also had direct connection with retired doctors who have indicated they are certainly able and willing, subject to requirements. And again, I just think that this makes a great statement about this community coming together. So I want to say sincere thanks to all who are involved in it now. And for those willing to volunteer, they would or support the requirements for inoculations, to reach out to the health unit and make sure that we're aware of them as well.
Thank you, Mayor Holder. Let's go to our next question. It's from Jennifer Beeman at the London Free Press. Dr. Mackie, this one is for you. Dr. Mackie, do you support the latest move to prioritize long-term care residents and worker vaccinations over hospital staff?
So it's not a matter of over or under. What we know is that this is where people are dying, and the vaccine needs to go to long-term care to prevent deaths. So in that sense, we do support the prioritization of those in long-term care residents and those caring for them, because we know that the research and data we have suggests that that will be the way to prevent the most number of deaths.
All right, let's go to the next question, and there are a couple of follow-ups from Jen Beeman. Dr. Mackie, is the health unit still expecting to receive Moderna doses in the coming weeks?
Yeah, it's a great question, Jennifer. We're still working with the ministry on the significant shipment of Moderna doses that had been scheduled, but was reallocated to some of the other areas that are harder hit than London right now. We've received a very small number of Moderna doses, essentially enough to test out our cold chain processes and get familiar with the product. But not enough to make a meaningful difference to the campaign here. So we're still hoping for that in the next few weeks.
And a final follow-up from Jen, Dr. Mackie, do you think the London area is at the peak of the second wave of the COVID pandemic?
I wish I could say that we were, Jennifer. I don't think we have peaked yet. I think we're still climbing. It's nice to see things leveling off for a few days. But I don't think that we've reached our highest case counts yet, and certainly we know that deaths are delayed, so that peak could be even further in the future.
All right, a welcome this afternoon to a first-time attendee for the virtual media briefing. Wendy Spence, editor at the Dorchester Signpost, is joining us. Good afternoon, Wendy. Thanks for being here. Here's a question for you, Dr. Mackie. Since many people that are at risk of more severe disease or outcomes from COVID-19 have underlying conditions that are a result of lifestyle choices, diabetes, obesity, and others, has the health unit given thought to getting messaging out to the public about ways people could improve their health?
Yeah, thanks for the question, Wendy. Health promotion is something that the health unit does on a regular basis. It's a core part of our mandate. It's obviously something that it's been harder to completely fulfill our responsibilities in health promotion because of the health protection, the infectious disease issues that have been so pressing this past year. We are continuing, we do have school nurses, for example, deployed into schools. We do have work that is, tobacco is a leading cause of morbidity and mortality in our communities. And so we're continuing a number of our tobacco prevention and cessation programs. So there are a few things that we're doing there, but certainly wish that we had the bandwidth to do more of that.
And just on that, Dr. Mackie, you were mentioning about tobacco programs and health promotion. National Non-Smoking Week is coming up next week, so we will be trying to get some messaging out about that as well. On to our next question, and this is a question from Hope Mahood, who I think has been a long time since we've had Hope join us from the Western Gazette. Dr. Mackie, with the stay-at-home orders, why is Western University still able to run some in-person classes with up to 10 people?
I appreciate the question, Hope. There is an exemption in the stay-at-home orders for attending education at school, daycare, etc. I don't have the details on what classes Western is offering, so unfortunately I can't comment further at this point.
All right, let's go back to Andrew Graham from Global News Radio. Dr. Mackie, he has a question about the latest on the progress of local vaccinations. He's curious to see if we've got any more stats. He mentions that on Monday's virtual media briefing, you had mentioned that about 2/3 of long-term care staff had been vaccinated. So he's just looking if there's any indication of progress on local vaccinations.
I appreciate the question, Andrew. The focus is shifting onto residents. So we are getting out to roughly one long-term care home a day, and hopefully accelerating that next week and the following week. One of the challenges from a data perspective is that we access the data through working with the ministry, and so we don't have direct access to real-time reporting on that sort of question. But I absolutely agree it would be helpful to have that information.
All right, next question comes from Jane Sims at the London Free Press, and Dr. Mackie, it is for you. Dr. Mackie, has General Hillier said when we can expect a more reliable supply of vaccine and when we will be able to ramp up clinics for folks beyond the long-term care and retirement home populations?
Yeah, thanks, Jane. So the question around vaccine supply, ministry has asked that we do refer those sorts of questions to them. What we have, seen in public materials is that certainly by April we'll see a stronger pipeline and more availability of vaccine, and hoping that by late March or early April we're able to expand even beyond healthcare to that phase 2 group. But you'd have to look to the Ministry of Health for more details on that.
And from a question about reliable supply to, again, an estimate of when vaccinations can resume for hospital staff. And this one comes from Leanie Lambrink at CBC London. How long will the vaccination of long-term care staff and residents take before hospital staff can get back in the vaccination queue?
Yeah, so at the moment we're being directed to vaccinate those in long-term care and those providing care there. We've also been clearly directed that retirement homes, beginning with high-risk retirement homes, are next in the sequence. Beyond that, there's some discussion about ALC patients in the hospital. So these are people who are requiring sort of a long-term care type of service, but there isn't a bed in a long-term care facility available for them. So they're essentially, long-term care, but in the hospital temporarily. That those might be the next group after long-term care and retirement homes. We don't have clarity around where we would pivot next. It will take us likely the next 4 to 5 weeks to get long-term care and retirement homes done.
All right, the next question, Mayor Holder, is for you, and it comes from Megan Stacey at the London Free Press. Mayor Holder, you're stressing that police will not randomly stop cars. How and where will the stay-at-home order be enforced? Will that be done by police or by law or a combination?
Thank you, Megan. I would say primarily by law enforcement on the stay-at-home order. Certainly the police can and have been involved in the past. Typically that's complaint-driven. So when someone might see an unusual high number of vehicles outside a residence, it may be appropriate to place that call, and either by law enforcement or police will respond to that. So it's a combination not based specifically on availability, but again, in the main, probably by law enforcement.
Very good. Thank you, Mayor Holder. And a follow-up question for you from Leanie Lambrink at CBC London on a related question here. Mayor Holder, what can people expect from bylaw officers over the next month? Will they be patrolling parks and other public places?
Hi, Lainey. I think it's going to be a combination of a variety of responsibilities. Certainly, the notion of patrolling parks and recreational areas to ensure compliance is part of it. I think, as I mentioned in my query to Megan, that calls relating to crowd sizes in homes will be there. And you will know that one of the other things that we do is we have responsibility for ensuring compliance as it relates to malls. Now, malls are pretty much shut down, and I will say to you, I know that at the various entrances that are open to malls, that there is typically security there that asks the question about why an individual is there, because there's normally a specific area for pickup in designated places in malls. I'd also suggest that, again, this comes down to initially probably more education than fining. And so, depending on the gravity of the circumstance, both the bylaw and police service are not shy to lay a fine, but I think education is still the primary focus.
Thank you very much, Mayor Holder. Let's go to our next question. It comes from Andrew Graham at Global News Radio, AM 980 CFPL. Dr. Mackie, this one is for you. And folks who joined us on Monday will remember that you joined us remotely. You were out at the Oneida First Nation. Dr. Mackie, did you gain any new insight on the outbreak at Oneida Nation of the Thames following your trip there on Monday?
Yeah, the main issue on Oneida Nation of the Thames, because of the independence of that nation, the shutdown measures over the holiday period were not in force on Oneida Nation. So you saw a lot of family gatherings, and it is a tight-knit community, so with large families. So that was definitely part of the spread there. So far, the elders and sort of knowledge keepers of the community have been relatively spared by that outbreak. One of the requests, we did request permission of the chief of the Oneida Nation of the Thames to enter onto their nation to provide the vaccination. The chief was appreciative of that request and also asked that we try to obtain some vaccine to provide to the elders and knowledge keepers of that community. And with the support of the provincial government, we were able to do that. So we're very much hoping and anticipating that that move to vaccinate that population early will mean that there is less of the very serious outcomes than we've seen in some other places.
Thank you, Dr. Mackie. And just a note to our media who are in attendance this afternoon, we're getting down to the end of the questions and we still have a little bit of time left. So if you've been holding back, now would be the time to submit those questions before we do wrap up this afternoon. Let's go back to another question from Wendy Spence at the Dorchester Signpost, and it's a follow-up to the earlier question for you, Dr. Mackie. What are some ways that people can improve their health to help their body fight COVID?
Yeah, I appreciate the question, Wendy. The major impacts on health in terms of preventing COVID are really about reducing your exposure to other people. So keeping your distance, wearing a mask, only going out when absolutely necessary. This is absolutely intervention number one. And then intervention number two is vaccination. And unfortunately, we're in very short supply. There have been many claims about vitamins or minerals or certain diets or yoga or other exercises being able to prevent COVID. There is not research evidence that supports any of those claims at this point.
Thank you very much, Dr. Mackie. That does bring us to the end of our questions this afternoon. I'd like to thank you and also Mayor Holder for your time. Just as I was wrapping up, we got one just in under the wire, so we will get to that before I sum up. Carrie McKee at CBC London, just sliding into home here before we wrap things up. Carrie has a question for you, Dr. Mackie. Can you please provide more information about what is happening at the Agriplex now that LTC homes are the priority, and that would be for vaccination, of course.
For sure. You will see around 600 vaccines a day, trending down over the next few days at the Agriplex. That's primarily second doses. There have been some first doses that have been booked already. Those are not being canceled. But there are also lots of second doses from 3 weeks ago when the first doses were happening at the Agriplex. So those will be ramping up and taking a significant portion of the supply over the next couple of weeks. And then after the second doses, it'll really depend on what the supply looks like, whether we're able to restart initiating first doses at the Agriplex, or whether we have to slow that on-site work down to finish the campaign of outreach to long-term care and retirement homes across this health unit and the 2 neighboring health units partnering on that clinic.
Thank you very much, Dr. Mackie. All right, how about this? Going once, going twice, 3 times, and gone. That does bring us to the end of this afternoon's virtual media briefing. Thank you again, Dr. Mackie. Mayor Holder, thank you also for your time, your insights, and your thoughts as we continue to address the challenges of COVID-19 in London and in Middlesex County. Thank you for joining us this afternoon. We will be back on Monday at 2 p.m. with our next virtual media briefing, and we look forward to having you join us then. Between now and next Monday, have a great rest of the week and a great weekend, and we'll see you later.